Some journal at 11,
Sorry?
some journal at 11.
Yes. Assalamu alaikum and welcome everybody. My name is Dr. Yousef Said. I'm a diabetologist and internal medicine specialist. Today with my colleague, our clinical dietitian, Suzan Najem, we will have the topic how to stay healthy and have a safe Ramadan and fasting in Ramadan. I will just give another 2 minutes for everybody to join, and then we will start with the presentation. Okay, let's start. So yes, the holy month of Ramadan is one of the important months for us Muslims during the year, and there are not only healthy patients who want to fast during this time, but also patients like diabetes patients who want to fast. We know already that, for example, for diabetes patients, there is a higher risk to have complications like high or low blood sugar because of physiological changes in our body. I will explain this later, and I will also show the importance for especially diabetes patients to have a pre-Ramadan assessment with the healthcare provider to see if they are eligible to fast, and if they're eligible, what to do, and to have a proper education to have a healthy and safe Ramadan. And all the recommendations what we are doing today, it's all not only for diabetes patients, it's generally for everybody. The importance to know that healthy diet and a right habit of fasting is very important. Well, as you can see that there are changes happening in Ramadan. It starts with our meal scheduling, the fluid intake, and the circadian rhythm what we have, so our sleeping patterns are changing. It can happen that we can lose weight during the time of Ramadan. And then for diabetes patients, the risk is there that they can have glucose fluctuations, and then again the risk to get low or high blood sugar. And we see, for example, very nice in this study with this graphic that especially after Iftar, the blood glucose can raise very high, and that's for sure, as we know, for diabetes patients, not ideal and can make complications. One example is, as we can see, the sleep. We know that the sleeping time is decreasing during Ramadan, and not only the total time, but also when you're sleeping, as you can see, is changing. That has, of course, to do that we have our Iftar. Some are going to the Tarawih prayers, and then we have also the Suhoor meal, which also can then change the sleeping patterns. Why is it so important? So sleep can affect a lot of things in our body. It can affect your mood, yes, and concentration and cognitive functions. And we know that again in Ramadan, these patterns can change, and what we also will later let you know is to avoid to have really heavy meals, because these can also impact your sleep. For sleep, for example, we know that there are different stages of sleep, and we know that, for example, the REM sleep is the phase where your brain is recovering, and the deep sleep is a time where your body is recovering. And if there are changes in these can, of course, then impact your body, your hormonal and your metabolic system, which can make it, especially for diabetes patients, then more difficult to manage their blood glucose levels. I mentioned already that because of Iftar and Tarawih and Suhoor times, the sleep cannot be like pre-Ramadan before, but it's still recommended to try as much as possible to follow this pattern as before. And for example, we know, especially in younger individuals, that they can get weight gain because of decreasing of sleep duration. So as a summary, we can say that in Ramadan, for fasting patients and for everybody, there is a lifestyle change because of changes in sleep, in meal plans and physical activity. The medical benefits from Ramadan, from the medical aspect, is that you can improve in weight and that you can potentially reduce harmful vices like smoking and other things which can harm your body. And as I already mentioned, the adverse effects can be through sleeping changes, through the glucose fluctuations which you can have, that really then can have an effect on yourself, that you're feeling tired, or even for diabetes patients, if they're not well prepared, the fear and the anxiety to get complications. So what's now important, and this is one of the important messages today, it's the pre-assessment, Ramadan assessment. What this means. So your healthcare provider should do first with you a risk quantification. This means that we will split you to different categories of risks. We are using the IDF 2021 risk calculator. It includes, for example, which type of diabetes you have, and what is your medication and therapy, how stable you was before Ramadan, do you have any other diseases and complications, and all this is coming together. And with the risk score, we are putting you then in different categories. And as you can see, if you're in category 3, then you can do fasting. If you're in category 2, we are already saying you should not fast. And if you're in category 1, as a very high risk patient, we say you must not fast. So if you fall in the category 3, so for moderate or low risk, then it's really important to have a proper education. And this includes, you should know when you should measure your blood glucose. And as an example, for type 1 diabetes patients who are on insulin, there are several points during the day, a 7-point measurement, for example, where we are telling them to manage their blood glucose. And of course, for any other type of patients, it's important to know when they should measure their blood glucose. Suzan will later advise you about fluids and dietary intake and exercise advice. And as a physician, we will have to speak about medication adjustments. So oral medication, when you should take them, insulin adjustment, so reducing or sometimes even then also increasing the insulin is important. And what is also important is to know when you should break your fast. So the recommendation is here really clear for diabetes patients. If you're less than 70 or more than 300 milligram per deciliter in your blood glucose, then you must stop and break your fast. It's also important to know for those patients who are taking insulin, that insulin is not breaking your fast, and it's the same for blood glucose taking. So this is an important message to know, that you can take even insulin during your fasting. So to make a summary, and then to give Suzanne the chance to explain you about dietary and exercise, it's important to understand that there is a physiological change during Ramadan for everybody, that these changes can affect for diabetes patients their blood glucose levels. And then it's really important to have the pre-assessment, Ramadan assessment. And again, if you're eligible to do fasting, then you need a proper education. So that's now for my part. I forgot already to say at the beginning, the Q&As will be at the end of the webinar. So Suzanne will now continue, and after that, we are then free for any questions.
So as dietitians, we always recommend eating healthily and sensibly all year round, of course, but also during Ramadan, it's very important, and role here is even more important during this period, not only to achieve optimal diabetes control, but also in helping people who are overweight and have type 2 diabetes to improve their lifestyle and lose weight. As we know, this may result in better glycemic control and may even help reduce cardiovascular risk. In fact, Ramadan is an excellent opportunity for you to actually start changing your lifestyle, nutrition habits, and even maintain a good blood glucose control even beyond the month of Ramadan. But only, of course, this only if you follow or you do the right way. If we do it the right way, we can actually benefit from Ramadan, because during the holy month, there is actually a drastic change in dietary patterns compared with the other months, of course, and lots of health issues arise due to improper eating or unhealthy eating habits. And many of the common issues we see, like eating large meals, just like you saw at Iftar on the graph, might cause a spike or high blood sugars post the meals. And not only that, but may cause also weight gain, because calorie consumption at only one meal at Iftar could go up sometimes to 1,500 calories, which is approximately what someone might need for the whole day. Also, we see a lot of consumption of processed carbs, a lot of sugars at Iftar, and in the periods between Iftar and Suhoor. This also definitely can cause high blood sugars. Desserts full of sugar, full of calories, might cause weight gain and spikes in blood sugar levels. Another common issue is eating at fast speed, so eating quickly, not taking your time during Iftar, which may really cause overeating. We do know that satiety signals usually take like 20 to 30 minutes to reach the brain from the start of eating. And just like Dr.Yousef mentioned, like the changes in sleeping patterns during Ramadan may affect metabolism and cause weight gain. Usually when we're deprived from sleep, our metabolic system runs out of balance, and this definitely causes changes, or it affects the dietary choices people make, like you start craving more carbs, you eat more, and this causes weight gain. So to promote weight loss, or let's say avoid weight gain during Ramadan, it's really best to control our calorie intake from food and keep them within target. And this differs, the calorie requirements, from one person to another based on gender, height, weight, age. So it's recommended that we distribute our calorie intake proportionally between Suhoor and Iftar, such that 40 to 50% of our calorie intake makes up Iftar, 30 to 40% of our intakes goes for Suhoor, and 10 to 20% of our intake for the snacks in between. So I'm going to walk you through a typical day after iftar. And as we always say, we have to start to break our fast. We need to hydrate really well, and we always stress on this point to avoid any side effects and to replenish all the lost electrolytes during the fast and avoid headaches, dizziness, indigestion. So plenty of water is required before iftar. And here I would like to stress on trying to avoid all the sugary, sweetened beverages, canned juices, or even the fresh juices with added sugar, as these tend to definitely increase blood sugar levels. And not only that, but you'd be with the consumption of high sugary drinks, you're actually drinking more of your calories versus eating them. And we consider these to be empty calories, so not very nutritious, just adding more calories to your meal. So the preferred beverage to have here is always water. So try to have like 2 cups of water at iftar, and then a cup of water every hour, and then 2 cups at suhoor to reach 2 liters of water per day. And then we move on to the dates. So we try to have like 1 to 2 or 3 dates depending on your caloric requirements, and dates are definitely very important as they are rich in potassium, magnesium, iron. They give us a quick source of energy and help bring back our blood sugar levels to normal after a long day of fasting. And of course, they are very high in fiber, and this helps prevent constipation, a common issue during the fasting. We move on after that to our salads. We try to have a big bowl of salad, again, while just watching out for the amount of added oil to our salads. Even if we're adding olive oils, this is rich in calories and fats. So if we're trying to maintain our weight or lose weight, we really need to watch out for that and be careful. Like some salads like fattoush can have fried bread, which again is an extra source of added calories and fats. Then we move on to having the soups, and definitely it's recommended to increase our protein intake. So we can have different sorts of soups with proteins, with vegetables. We try to have non-creamy based soups, or at least low-fat, use low-fat. Try to have more homemade soups rather than the ready-made ones, because of the ready-made ones can contain a lot of sodium. This may cause us to be it can cause a lot of thirst during the rest of the night. And then we can move on to having the most favorite for a lot of people, the pastries. And definitely it's okay to have these, but we can always modify the recipes. We can have them baked instead of fried. We can have the vegetable ones rather the cheese and the meat ones, just to decrease a little bit on the calories and the fats. And as you can see, a typical Ramadan plate here, we move on to the main dish, and we try to include complex carbs, proteins, lean sources of protein. So complex carbs are lower in glycemic index. They have a lot of fibers, and this helps us maintain our blood sugar levels. Fibers helps us to feel full as well. Legumes, for example, whole wheat bread, whole grain rice. The proteins are important as well. We try to choose lean sources from fish or skinless poultry. Legumes again have proteins, and these are important to help preserve our lean body mass and also to make us feel full. And of course, fats are also as part of this meal. As you can see, the teaspoons of oil in moderation. As we said, fats are important to give us energy and also a feeling of fullness. But we try to choose the good fats, the polyunsaturated, monounsaturated ones like olive oil, fatty fish, which has a lot of good omega-3 fats. After the main meal, like after taking a break, we can have like a small snack. And here I know it's irresistible to have the yummy Ramadan sweets, but as much as we can, we try to control our intake and try to have them on 2 or 3 times a week. Again, we can modify the recipes to have them baked without syrup, just to cut down on the use sweeteners, for example, to cut down on the sugar and the calories. On the other days of the week, we can go for yogurts with fruits, raw nuts are good options. And finally, we reach to the main meal, which is the suhoor, and this is a very common mistake people do. So I hear lots of people skipping suhoor, or maybe having suhoor at midnight, so they avoid waking up at sunrise, and definitely this is one of the most common mistakes. And this means when we skip or we have it early, we're fasting for longer period of time, and this increases risks of dehydration and low blood sugars throughout the fasting day. So it's always easier to balance your blood glucose levels through the fast if you have a meal at suhoor, and try to have it at sunrise. So again, suhoor is very important. It gives our body a source of energy to make it go through the fasting days. It prevents headaches, nausea during the fasting day, again by regulating our blood sugar levels, reduces thirst, and just like the iftar, we try to include all the main food groups: complex carbohydrates, proteins, good fats, dairy, yogurt, low-fat yogurt or milk, and we choose the slow-releasing carbs that provide the body with energy for longer periods of time, so that you can have as much energy as you can throughout the day. And then we come to exercise during Ramadan. And of course, as we always recommend, it's important to keep doing exercise. If you're trying to maintain your weight, if you're trying to lose weight, exercise is very important. Even if you're trying to maintain your diabetes, or control your diabetes throughout Ramadan, exercise is an important factor. So when do we do the exercise? We always recommend for people who are elderly or people with diabetes to try and do their exercise after the iftar. So probably when you break the fast, have your soup and your salad, and then maybe go for a low or moderate intensity exercise. So we're looking at walking, brisk walking, these kind of exercises to go for. It definitely, just like I said, has a lot of importance in regulating your blood sugar levels. And the recommendations are usually like 150 minutes a week, so 30 minutes on 5 days of the week, for most people. For those who have no medical issues, they can choose to exercise before iftar, but definitely not recommended on the hours like 3 to 4 hours before iftar. We prefer for them to do the exercise early on in the morning when they still have some energy to go on throughout the day. Thank you.
Great, thank you very much. So now we are going to the Q&As. Let me set the light. Perfect, so now you can see us also. Here are the Q&As, so now I'm not seeing any questions. So let's wait a little bit. I can say a little bit again of something to exercise, as Suzan mentioned, that again, physical activity is generally very important for everybody, also during Ramadan. And we are seeing always, especially our diabetes patients individually. So we will see how the experience was before with exercise, how stable it was with during the blood glucose levels during exercise, so that we can give them the right recommendation when to do if generally to do exercise. And for everybody else also, it's important to have the right timings, and the fluid intake is really then important for that. So good question. Can I take the COVID vaccination during the fasting period? If there is no till now any contraindications to say you cannot do it. You have to only know to understand that the vaccination generally can make flu symptoms, COVID symptoms, and in these times, then you need the right intake of energy and fluid intake, and that can be then that maybe you have to break your fast in those times, or that at least 1 to 2 days after the vaccination. Second question, that's something for you. Should we substitute sugar with honey during Ramadan?
So again, honey is definitely a better alternative to sugar, as it's more natural. If we're looking at the natural honey, not the typical ones in a supermarket. However, they do affect our blood sugar levels the same way. So we try to have it in moderation, not like unlimited quantities, because it does have an impact on our blood sugar, just like the sugar.
So the next one is, thank you, it was very informative. Would you be great to receive presentation to roll it out through the rest of the team? Yes, we will send the link so you can get the presentation. At what age should we encourage kids to fast? Look, if you see from the Islamic perspective, we are saying it's from puberty. Yes, so it's mostly 14 to 50 years. You can start to do fasting. Again, in the matter of if you are a child with type 1 diabetes, it's then really different. It depends how long the child has diabetes and how the risk again for low and high blood glucose are. We had recently a webinar about that. So again, the recommendations are clear for healthy children from puberty and age of 14 to 15. Can sleeping at daytime affect the physical benefit of fasting? So again, as I showed you the presentations before, the recommendation is still again to have as much as possible your sleeping patterns as you had it before Ramadan. Yes, and everything else can influence your body and change your metabolism. And this can, of course, affect then the benefits of fasting. Again, please share the link for this slide. We will do. Yes, the question is why it's not good question. Why it's not recommended to do exercise few hours before Iftar? You can do if you have the energy, as you already said. You can, but it's again important. You have to understand for a diabetes patient that you can go if you do 3 or 4 hours before the Iftar your exercise, that you can go to low sugar levels, which can be dangerous. And again, you have to think about the fluid intake, so to avoid dehydration. But generally, if you feel good and you're not diabetic, you can do definitely. It depends again how you're feeling, and also depends how it was before your last experience. So therefore, again, that's what I'm saying. You have to discuss this with your healthcare provider, with your team, because they know you best, and to see how you was always before, to find for you the best solution. So there's another question again for which case? Okay, in which case fasting does the opposite and make the body storing fat? Well, I think I never heard that fasting is doing storing fat. Did you hear anything about that, Suzan?
No, maybe like more when we talk about very low calorie diets for very long periods of time.
True.
But not like fasting during Ramadan or
intermittent. And again, it's more when you break the fast, what you're then eating. Exactly. Yes, that's more which influencing then the amount of your body fat. So yeah, somebody said, you said exercise after iftar is better than a couple hours before. What is about before or after suhoor? So we said already that after suhoor we have enough energy, so at the morning to do that. Again, from iftar on, yes, we are saying you should start, you can start to do exercise, and it depends again individually. If you're a diabetes patient, it's a little bit different, and if you're a healthy patient, again, it is then important for you to try and see. That's also important. Yes, everybody is not the same, and everybody's metabolism is not the same. So the general recommendation is again for diabetes patients or older patients after iftar, and for everybody else mostly at the morning. What time is best for coffee that affects less sleep and routine?
So of course, the further away from your sleep, the better. But of course, it's best during Ramadan to try and substitute coffee for more herbal drinks that have no caffeine. This way, we'll be taking more fluid during the period between iftar and suhoor. And because coffee or caffeine in general is considered like a diuretic, so we try to avoid it as much as possible. But if you're going to have it, of course, as away as possible from your sleep times.
Thank you. The next one is, will you share a video recording of the session? Yes, we will. You get a link for that. So somebody's saying, I have gained 10 kgs during last year Ramadan. Not sure if it was because of work from home, missing exercise, eating heavy, taking a lot of oils, sweets, cheese, all of them. I need to ensure I do not gain any more weight, rather lose some this Ramadan. Any specific recommendations?
So as I said, we have to stick to the target calories that we need per day to be able to lose weight. And as I said, this differs from one person to another. So if we follow a calorie deficit, then we know for sure that we're gonna be able to lose weight, and we organize our meals at iftar, suhoor, at snacks. So it is doable for sure, but we have to follow like a proper meal plan.
Thank you. The next, is diabetes the only disease that we need to watch out for during fasting? No, any chronic diseases has to be watched out. As an example, as patients with blood pressure. So if you're also on blood pressure medication, you have to understand during the day when you have the no fluid intake, you can have low blood pressure, and that's also important to avoid. So generally, no, it's not only for diabetes patients. Any other chronic diabetes patients like blood pressure and also cholesterol patients, yes, they can have the wrong eating habits, of course, then an increase of lipids, which is then also can affect your body. Next question. If I'm working from 9 a.m. to 3 p.m. during Ramadan, what is the best plan for my day in terms of exercise and sleeping? These days I'm waking up 4:30, work out from 5 a.m. to 6 a.m., then go to work from 7 a.m. to 4 p.m., then walk outdoors for 1 hour and sleep by 8 p.m. This routine is great for me. I mean, look, this is a normal routine, not under the conditions of fasting. Yes, so as we already mentioned, you can do exercise in a low and moderate way during fasting. Yes, we are not saying you should really stop your exercise, but again, be aware that there is a physiological change in your body, and therefore it's important to understand that exercise cannot be done 100% the same like before. Yes. Good. Thanks a lot for the webinar. I've heard instead of coffee, an apple is a way better option to energize. Is this true?
So if we're talking about breaking the fast, definitely coffee is not the only option. Even better than an apple is the dates or the dried fruits, because again, they give us even a quicker source of energy than apples. So yeah, fruits can be better than coffee.
Definitely, and they're fiber.
And fibers, yes, and all the benefits we discussed about dates are almost the same for other dried fruits.
True. Great. So I think we can wait 1-2 minutes. If there's no questions, then we can stop for today. A general reminder also for the pre-assessment Ramadan that you should do this a few weeks before of Ramadan. So take the opportunity and go to your healthcare provider and get really the right recommendations. So, any avoids for fatty liver patients during Ramadan? Yeah, I mean, fatty liver is definitely a disease where nutrition is very important, and therefore, again, it's always normally the similar patterns for diabetes patients the same, so that you should, whatever Suzan has said already, it's important to do the same also for fatty liver patients.
So the general recommendations are the same for people who are have diabetes or not. We always recommend healthy eating for the general population, and this works for any chronic disease usually. So healthy eating, low fat, low sugar, low salt. So all of these are recommended.
And you have to understand all these diseases like fatty liver, cholesterol, diabetes, even blood pressure are metabolic diseases. Yes, so it means your metabolism is impacting this, and therefore diet and nutrition is so important.
Yes, definitely.
Good. This was the last question. Thank you very much. I hope you learned today a little bit from our side. Thank you. Have a great day. Okay.